Kia ora tātou. Thank you all so much for joining us today for our exclusive launch of Medtech AI. I'm Liz Agnew. I'm Medtech's Product Manager for New Zealand. So this is a really hotly anticipated webinar, and we expect that you may have questions as we run through our demonstration. So please feel free to click on the Q&A button at the top of your screen, and then you should see an Ask a Question button on the Q&A side panel. And if you send us through your questions, and we'll aim to get through these at the end of the session today. Also, for anyone who may have a colleague or associate who was interested in attending today, but for any reason couldn't fit it into their busy schedule, we are recording this session, so it will be available from our YouTube channel in the coming week or so. So today I have with us Lawrence Peterson, our GM of Integration and Infrastructure, who will be talking to us about security and compliance, as well as Cecilia Harris, who will be demonstrating the full capability of Medtech AI. Assisting with our Q&A session will be Chrissy Patterson, our GM of Product, and Alex Cobble-Chantrien, our Program Manager for Medtech Alex. So what is Medtech AI? Medtech AI is your intelligent AI layer, which is fully integrated with your Medtech Evolution PMS. There's more than just a scribe. It works alongside you to deliver smart clinical support, surfacing a complete patient context, which is displayed in a configurable dashboard, and enabling clinician-controlled documentation from consultation notes to referral documents, with information automatically recorded in the correct place within the patient record. Like your observations will be added into screenings, for example. How Medtech is helping clinicians, Medtech AI. So Medtech AI helps reduce the documentation burden so clinicians can spend more time focusing on patient care. It minimises manual note-taking, giving clinicians valuable time back during the day. By removing that copy and paste workflow that other non-integrated scribes have, it helps reduce clinical risk and supports more accurate, higher quality documentation. It also allows clinicians to stay fully present with patients during consultations. The system creates clear, structured records that improve patient understanding and communication. During consultations, it can also identify important signals such as a patient's health literacy, their emotional cues, and communication needs. Importantly, Medtech AI is designed specifically for New Zealand healthcare privacy requirements and clinical workflows. So ultimately, the goal is simple: more time, higher clinical accuracy, less admin for clinicians, and a better overall patient experience. So who is it for? Medtech AI is built for clinicians and healthcare organisations using Medtech Evolution, who want to reduce documentation time and improve clinical accuracy. It's for primary and community care practitioners, specialists and acute care providers, and for virtual and extended care. You'll see our mobile app that is ideal for out-of-clinic consultations. Our key benefits of Medtech AI is that it supports clinicians in real time during consultations while reducing administrative workload. It automatically captures the conversation, saving around 6 to 8 minutes per consult, and cuts down on after-hours documentation. And because it integrates directly with Medtech Evolution, clinicians can stay in their normal workflow with no copying or re-entering of patient information. Clinicians remain in full control, reviewing and approving every AI-generated note before it's saved. During the consult, the system also surfaces relevant history, medications, and other key patient information to support faster clinical decisions while generating clear summaries to improve the patient's understanding and follow-up. Importantly, it's designed as part of the Medtech ecosystem, extending the capabilities of Medtech Evolution and enhancing rather than fragmenting the technology clinicians already use. So enough of the talk. I'm now going to hand over to Cecilia to demonstrate Medtech AI. We'll start by looking at the web browser-based functionality, and then we'll look at the mobile app. And I'll just start with a disclaimer. We will be demonstrating Medtech AI live today, and as with any live technology demo, there's always a small possibility of connectivity issues. So if that happens, we'll be able to pivot to our plan B. So I'll hand over to you, Cecilia.
Thanks, Liz. Stay on the line with me, because you're going to play patient for us today in the demonstration. So very excited to be able to demonstrate this to the group today, and want to start by framing that, I'm not not a doctor or a nurse. I'm here to demonstrate the functionality of the product and talk through the features. I know the team moving forward will be able to go through this and allow you to test it in a far more clinical environment. So please be kind to me if my clinical knowledge isn't quite as strong as it should be. So just starting that, we're sitting in the browser. We're sitting in the browser, but fully connected with Medtech Evolution. The reason that we're sitting in the browser is because we're going to use the microphone. We want to be able to use it in a mobile app environment. We want to make it as seamless and as easy for you as clinicians to use. And Liz started off by saying, Medtech AI, more than a scribe. But before we launch into, surfacing all that information out of Medtech Evolution, let's just talk about some of the core functionality of a scribe to just tick that box off that, yes, we've got all of that functionality within there. So we've got two key components that we talk about when we're looking at our notes. We refer to notes or prompts in the system. And we can set these up and they can be customized in any way that is relevant to you or your team. So some examples that we've already got in the system is an ACC, an ambulance mental health triage. We've got some concise clinical, generic geriatrician, mental health. And more importantly, you can have any note in any format that is relevant to you. And we can work with you to make sure that these notes are delivering in a format that is relevant to you. But in addition to our notes, we also have templates. So what's the difference between a template and a note is the templates can go out through the outbox and they're far more structured. So they have different sections within there, and we can create different examples within here. And I will just edit an existing one that we've got where we can choose our tone, our style, our structure, and we've got then our various sections. And within the sections, we can really detail what we want included and what we don't want included, and get that to really meet your voice and how you want information to go out. Rather than you watching me type, we'll just have a look at what that looks at. We've also got the ability within the system to customize what you see when we go into the system, what gets generated. And so when we're looking at these screens, we're going to have lots of information on them, but you can choose what you want generated and what you don't want generated. So that's just a bit of the start of, the notes and the customization. And we can basically, anything that you need in terms of generating the notes, we can make sure it comes out the way you want it to. But the first thing is, if we're sitting outside the system, how do we grab our patient? Well, we can do a search for our patient on their first name, last name, date of birth, NHI number, or if you're using the appointment book, you can get the patient out of the appointment book. And you just saw it click over there, and it's actively looking at what's in the system. So we can see our patient Sally's arrived, and we can click on Sally. So as we're bringing Sally into the room, we can check whether they've got patient consent. Now, this can be turned on or off. If you are capturing consent in a different way, perhaps on your onboarding process, we can turn this screen off. or we can have it so it is set up for every consult. So we can proceed with the recording. The moment we proceed with the recording, we're moving into the live transcription within here. And Liz, I will get you to, tell us a little bit about why you've come in today.
Oh, hi, Doctor. I'm just really tired at the moment because I've got this nagging cough that I just can't shake, and it's been going on for about 2 months now, and I'm just had enough. So I thought I'd come and see you today about that.
Okay. Well, while you're getting settled, I'm just going to look at some information about you and what's come up on my screen here. And I can see I've got a draft encounter snapshot, which has highlighted what has been discussed in the previous consult. So we were identifying that you've got quite a few issues in the system here. Everyone just keep in mind we've got a very sample patient here, so they have a lot of very strange problems in here. And we can see we've got a concise view of what's going on, but at the same time, we have a history of all the notes that are in the system. We've also got the ability to highlight notes that need review. So we've got one that was highlighted that needed review, so we can have a look at that. We can have a look at our test one that we did this morning, I think that was, Liz, where we also had an upper respiratory problem. So we've got all of this information available to us. In addition, we've got the current medications of the patient, the allergies, and the screenings. And so we can click on any of these and we can also see the history over time. And Sally has had very consistent blood pressure for the last several months, and we can see our conditions and our immunizations. We can also see upcoming appointments. We can see our previous insights, and we can also see the latest results in the inbox. And when we have a look at the mobile version, I'll log in as a different patient and we'll be able to see a little bit more detail in there. So there's a number of things that we can do now. We can continue on with our patient. If we wanted to generate some documents off previous notes, we can do that as well. But Liz, let's do your blood pressure. Maybe we'll say it's slightly elevated today. It may be 130/82. And I think we've noticed that you've got asthma. So how's the asthma going?
Well, with this cough, it's making really difficult to breathe. So I have been quite using my inhaler quite a lot lately.
Okay, and so are you still taking your Pulmicort?
Yes, I am.
Okay, and you're taking that morning and night?
Yes.
And are you taking your Ventolin as required?
As required, yes.
Excellent. And how is it that we can help you today? What?
Well, I'm just so exhausted by the coughing. I just really want, to be able to, find some way to get rid of it.
Okay. So what we might do is, how about you have some time off work first?
Oh, that'd be perfect. Yes, please.
Okay. Yeah. So we'll give you 3 days off work, Liz, and then we might even get you to go to someone that really knows what they're talking about. So we might give you to go to a respiratory physician. So I'll make a note to get you to talk to a respiratory physician because, yeah, I'm a terrible doctor, basically.
Thank you.
So obviously, as we're going through this, we want it to be there would be a normal clinical conversation here. But what we're trying to do is just demonstrate some of the features. So as we click over, we are then moving into the generating of the notes. The notes generate very quickly. We are generating more than the notes and they can take a few more minutes to generate. but the notes come through straight away. The notes can be in any format that you want. Obviously, we've got some various different formats here, and we can rerun them if they aren't to our liking. We can update and change anything from within here. We can also look at the patient insights, and we can have a look at what's been generated. So the health literacy was moderate. The patient correctly identified asthma and inhaler use. What we talk about a lot when we're talking about AI is transparency or a glass box. If the AI has concluded something, why has it concluded it? So if we're saying the patient literacy is moderate, why was that determined? Frustrated, patients stated they'd had enough and are just so exhausted by the coughing. So able to bring out that information within there. Most importantly, you can just hit insert and that will write back to Medtech. So we can click on that and that will write back to Medtech. So that will be going on. And at the same time, we've generated a patient summary that could be sent to the patient or the family, a to-do list for the patient, take 3 days off work, attend the appointment with respiratory physician for a specialist assessment of cough and asthma. We've got the clinician tasks that can be written back, the blood pressure. We're also tracking any observations that we talk about over time, and we can have a look at how that goes through. We've identified the patient conditions, then the chronic coughs and asthma, and all of these can be written back as well. We can also send this information to the patient, put it into myself, and we can do and send that off within there. Based on regulatory approval, we also have the ability to do an evidence summary, and we'll have a look at that when we're in the mobile version. But once again, we can create documents within here. So my example is a post-consult handover or many other options within here. I can have the various sections within there. I can include the your letterhead, the patient details and provider details. And this is one of the real things when we're talking about data living where it needs to live and the data living in the PMS system is when we're sending documents, we do need to put in things like date of birth and NHI number, patient identifiable information, but we don't want that coming through the AI. So when we generate these documents, that information is being directly pulled from Evolution, not from the AI. So we can hit generate. And it will pull out the reason for the visit, the current medications, the plan, what the template has told the being told to generate. We can then create a PDF, which we can get directly from the system, and we can have that come out there. But more importantly, we can also send it directly to the outbox in Medtech Evolution. So that has been directly now sent to Medtech. And before I jump to the mobile version, I might just jump into Medtech Evolution. And what we can see is, first of all, the appointment book that we were looking at there before. And then Sally, we have had a look at, this is what we've just sent through now, through the notes, come through instantly and up to date. And you can see that we have been doing a few tests on this today. So we've got quite a bit of information in here. And then we've also got that outbox document that we sent through before. And there's our documentation there all the way through as well. So Liz, if you just give me a couple of seconds to swap to the mobile version.
Okay, thanks, Cecilia. So up until now, we've been showing Medtech AI through the web platform, where practices can manage workflows, surface insights, and interact with the system throughout the day. But of course, clinicians and practice teams, they aren't always working from their desks. So it may be that they're moving between consult rooms or working across different areas of the practice or even outside the practice, and often need quick access to information in the moment. And so that's where we've got the mobile app. It can be used on mobile phones or tablets, and it'll be available via iOS App Store and Google Play Store. And so that's where the mobile experience becomes really powerful, and that's what we're going to demonstrate to you now. Thanks, Celia.
Love this technology on technology here today, mobile onto laptop over Teams. So always one of those really tricky technological moments. But I'm actually logged in now into a different medtech site. So I'm going to do a search this time, and I'm going to find my patient that I know by their NHI number. So if you're running the appointment book, obviously that will be also on the device, but otherwise you can just search for your patient within here. So we're going to pick up Belinda Price, and we're going to move straight once again into the consult. But while I'm on the device, I can also get all of that patient history, that snapshot that is available. We can see all the notes that are relevant for that particular patient. We can generate documentation straight from the device. So, you know, we've been out there talking to people, and this can be a real game changer for people that are out, you know, in front of aged care, in front of elderly, whereby, you know, they may not be the same person seeing the patient each time, and they want to review the notes, and just having that draft encounter snapshot available straight away can be really useful within here. And we can have a look at Belinda here, and we can have a look at her notes. Once again, her current medications, her blood pressure reading, and we can see her blood pressure reading this morning when we did a test went up by quite a lot in there, and the allergies, the conditions, the immunizations, and then once again the results for this patient through the inbox. So we can have a look at those lab results on the go, and this is pulling once again directly from the Medtech evolution system, and we can see all the details that have come through within here. So on your phone, easy to read, pulled together easily. So within here, what we could actually then say is your blood pressure once again is up. We'll say it's 160 over 92 today. So you've been on candesartan and hydrochloride. I never get that right, diuretic. And perhaps what we're going to consider is maybe we'll put in amlodipine as a third line agent. And perhaps I want to know if there's evidence for this. So as I mentioned, subject to regulatory approval, there's the ability to pull evidence summaries together based on what's been discussed in the consult. So we've taken, you can see transcript captured at 11:25. Excuse me, I'm in Australia, and it is so it's taking what we've spoken about. It's also taking the history of the patient and pulling that together. It is going and doing a detailed search of authorized sites, PubMed, and all the relevant sites, whether that's Lancet, BMJ, YAMA, whatever is relevant, as well as MIMS. It is doing that review. But that can continue on in the background, and we can continue our consult. So I will just minimize that, and I will go back up. And so, okay, we'll decide that we'll add in 5 milligrams of amlodipine for that. We might also get you to do a repeat blood test in another 2 weeks, and that will probably do for my demonstration. Liz, is there anything else I've not mentioned?
No, that I think captures all the areas that we're covering.
We're covering today.
Yeah, thank you.
So we hit stop, and once again we're moving through, and we're able to then get to our note. The note comes up, as I said, almost straight away. As I said, very poor clinical demonstration here. And once again, this can be directly updated into Medtech from the device as we speak. So that's updated there. And then once again, the patient insights, the to-do list, the clinician tasks, the patient summary, patient resourcing. So we also link in with Healthify, and this patient resourcing can be sent to the patient. So directly from within here, we can link to the Healthify stage, and we can find out, we can provide the patient with patient resourcing in language that makes sense to them. Just check whether that has actually, it's still going. It's really funny when you're doing this, it feels like a really long time in a demo. In real life, it's much quicker, but we'll just minimize that again. Once again, the blood pressure, we can see the blood pressure tracking over time. And if we've got things like HbA1c, LDL, temperature, heart rate, we can see they will all appear as we've discussed all of those key options there. And then hypertension is the code. And once again, this can be, all of this can be sent to the patient. And so we can have a look within there. I think the key thing to also highlight as we're going through all of this is that every single area that we're showing that is generated can be overwritten by the physician. It can also, and it can also be adjusted at any time by the physician. And we will just keep going on that. And
I do like that you've got the ability to review every item. You tick, 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 and then insert, and then you've got your full consult in Medtech Evolution where it belongs.
And while we are waiting for this, we might send the email and see what that looks like.
I think this feature is fantastic in ensuring that what has been spoken about is remembered. You've got, if you're dealing with elderly or very young, and you ask your elderly mother, what was your consultation about? What did the doctor say? If they can't remember, you've got this patient summary that will be able to summarize exactly what was spoken about, what the next steps were, what medications were supposed to be taken, etc. So I think this is a really valuable tool.
And everyone will, that Liz will tell you that it did come out, and it does come out. It's just, it's like watching a kettle boil at the moment. But while we're going back there, what we might do is I might just jump back to the browser screen and just once again highlight the functionality of the customization of it all, whereby if there is any of these items that we want to not have as part of our requirements, we can turn on or off depending on what your requirements are. And rather than watching the kettle boil at the moment, Liz, what we might do is we might now, I might jump, you know what? It has come up.
Perfect.
So as you can see, everyone there, anti-hypertensive therapy in elderly patients in the nursing home. So it took through the age of the patient when we were looking at this. It looked at the amlodipine combination in elderly patients, and it pulls everything through, and we can go through and we can go to view all the sources. And so what happens then is we've got all the sources available, and what we can do is we can click through. Next time, Liz, we're doing this, let's not do combination therapy because there is a lot of clinical data on this. And so any of these we can click through, and that will take us to the actual document, clinical paper. So this leads us back to this glass box point of view, which means that everything that we're doing can be verified. So there's nothing being generated that cannot be verified along the way. So as you can see, we can see this comparison of monotherapy versus combination therapy in hypertensive therapy for elderly patients. So that's me, and I'm going to hand back to you, Liz.
Great. Thanks, Cecilia. So now I'm going to move to Lawrence, who's going to talk to us about security and compliance.
Hello. Next slide, if I can have it, Liz, please.
Certainly.
So this is a Medtech Alex product, and it uses the Medtech Alex Fire APIs. Now, as the basic principle of the Fire APIs is to standardize, but to make available the data with consent in a secure manner between clinicians as they require it. It's giving access to that data with consent where and when you need it. And it's a really important sort of philosophy that we've held dear to here. And that philosophy is we don't necessarily need in day-to-day healthcare to be splashing the clinical record of our patients around and storing it everywhere, right? The data for the patient is stored in Medtech. What you've seen there is that summary data is presented as you are using it in Medtech AI. And it's really key there. The moment that the session is closed and you move on to your next patient, that data is not stored in Medtech AI. The data is actually dropped from Medtech AI. It is processed in line by the application as it is being used. What it does is it gives you that context and that transparency, right, that you can actually see and use and work with your data. It's the same data that you have in Medtech, but it's not sprayed around the ecosystem. It's not held in other places. Okay, really important concept. So really, that's what we want to try and do here is we want to build on these things with things that make sense to our customers, right? But when we're doing that, there's no learning models involved in terms of having a great big data lake of all the Medtech data out there and then running learning models over the top of it. This is presenting information to the clinician at the time they are consulting with the patient. It is enhancing and making their jobs easier, right? And the care that they can give to that patient easier per se by giving them all of the information directly in front of them and by allowing them to quickly and easily do tasks that would normally have them jumping through multiple screens. The clinical summary itself is actually provided using what's known as an international patient summary. It's a standard, and we use the NZ, International Patient Summary. And then for discrete pieces of information like screenings over time, there's a get of that data across the FHIR interfaces, and it's only there in contextual review, right? Once again, once that data has been used, once the consultation is complete, the transcript and any data associated with that is dropped. Now, we're very careful with our logging across all Alex products. To troubleshoot these applications, it's often quite difficult unless you have a little bit of information about what you were doing and when you were doing it. And in a clinical context, who was the patient, these sorts of things. We really want to minimize that sort of stuff. We don't want to be holding patient information, sensitive information, even NHIs, inside of a logging system for it to be tracked and looked at later. So all of that information is actually, all of our logging is much, much higher. We don't use the NHI to log against, right? We use other contextual and shrouded data, if you will, all right, or specific indexing and that sort of thing to be able to track these things back if and when something goes wrong. I think that's pretty much a good summary there, Liz. Happy to answer any other questions later.
Great. Thanks, Lawrence. If you have any questions, just keep popping them through on that Q&A feature. So one of the things that we consistently see when we're introducing a new product or feature is that the moment that it's in the hands of clinicians and practice teams, new ideas start to emerge. So what we've got here is a bit of a roadmap. We've been thinking ahead and we're alongside the capabilities that we're launching with, we've identified a number of key areas where Medtech AI can further support practices. We want to help reduce administrative burden. We want to improve clinical quality and unlock operational insights. So what I'd like to do next is walk through some of those, some of the roadmap concepts that we're already exploring. Okay, so as we look ahead, our Medtech AI roadmap is focused on helping practices work more proactively, reduce administrative workload, and unlock greater value from their clinical data. So one key area we're exploring is AI-supported inbox management, where AI could help triage and prioritise clinical inbox messages so that practices can respond faster and reduce the risk of important patient results being missed. We're also planning capabilities around recall management, where AI could automatically identify patients due for follow-ups, screenings, or chronic care reviews, helping practices strengthen preventative care and improve operational efficiency. In the area of medications, our vision is to support clinicians with intelligent medication insights, highlighting prescribing opportunities, surfacing safety considerations, and enabling easy access to medication information that can also be shared directly with the patient. Another important area is clinical auditing and governance, where AI could help monitor clinical activity and support compliance, quality improvement, and evidence-based care across organisations. We're also looking at eligibility indicators, which could help identify patients who may qualify for a specific program, screening, or a care pathway, enabling more timely and targeted interventions. And from a practice perspective, revenue intelligence is another big opportunity, using AI-driven insights to highlight missed billing opportunities and support coding optimization without adding to that administrative workload. We're also exploring pre-appointment screening, where patients could complete intelligent screening before their visit, helping clinicians to identify key symptoms or risk areas ahead of time and enabling a more focused consultation. And finally, demographic intelligence, where AI could identify and update patient demographic information to maintain accurate records and support better communication and care coordination. So together, these roadmap areas reflect our focus on using AI to support clinicians, streamline workflows, and help practices deliver more proactive and connected care. So as we begin introducing Medtech AI to practices, we want to make it as easy as possible for clinicians and teams to start exploring what the technology can do for them. To support early adoption, we're offering an introductory opportunity for the first 50 practices to come on board and experience Medtech AI as part of our rollout. And so for those practices who would like to learn a bit more about before getting started, we're also providing a number of ways to engage. So teams can submit a request form to register their interest. You could join a short mini demo session to see the product in action, or participate in our education labs, which are coming to a town near you, where we'll explore how Medtech AI can support clinical workflows. So these options allow your practice to engage in the way that works best for you while building familiarity and confidence with Medtech AI. And we'll also be sending out links to the above options via email after the webinar. Okay, so that brings us to the end of the overview of Medtech AI, and we'd now like to move into answering some of the questions that you've been submitting during the demonstration. There may be quite a few questions. We've got nearly 300 people in attendance, and while we'll do our best to get through as many as we can today, we may not be able to cover them all. And if we don't get time, don't worry, we'll update the FAQs on our website with your queries. And so with that, what I'm going to do is I'm going to hand over to Chrissy and Alex to lead our Q&A session.
Thank you, Liz. You're absolutely correct. We've got lots of good questions that have come through. So thank you guys for popping those through. We will get through as many as we can before the end of the session today. And to start off with probably the most burning question in the question section is, what is the cost of Medtech AI for practices?
That is a great question. So the pricing for Medtech AI, it will depend on the level of functionality that a practice chooses. So we're planning a number of different tiers to suit different needs. Our launch tier, which will be our core tier, is available for as little as $80 per user per month. And for practices that are interested in getting started early, just a reminder that we're also offering that introductory opportunity for the first 50 practices, which provides a great way to experience the product and its benefits. If you want to get more details about pricing and the available options, I'd encourage you to complete the request form or join one of our exclusive demo sessions or education labs, and we can walk through the options in more detail.
Brilliant. What kind of training is available for when we sign up for it? Good question.
That is a good question. Chrissy, can I hand that one to you?
Sure, not a problem, Liz. So we have a full onboarding team ready and waiting to onboard practices onto Medtech AI, and as part of that onboarding process, we will work with you to onboard and configure the users within your organisation that you want to sign up for Medtech AI. And during that process, we will provide training either remotely or on-site if you are local to go through the training and help you set up, configure, learn how to use the system, and work with you while you trial it and see how it goes.
Thanks, Chrissy.
All right, now probably our next most popular question. So when will this be available, i.e., can we start using it today?
Yes, 100%. Just scan that QR code, fill in your details, and we will be in touch with you.
All right, so moving on from those ones that were the most popular questions, does the use of the web browser mean that a GP doesn't have to record or review anything in Evolution?
Cecilia, I might hand that one to you.
So the notes, you don't need to put any notes in the system, and at the moment it's notes, screening, clinical tasks will all be handled from the browser. There'll be more functionality coming with the roadmap, but they're the four, and the outbox document, they're the four that will be available from today.
All right, the next one in the same sort of question, does it integrate with the public hospital referrals?
Chrissy, I'll lean back on to you on that at this stage.
Me to do that one.
I guess we do the private ones, I guess.
Yeah, so obviously Cecilia would have shown the referral being picked up as part of the consultation that her and Liz demonstrated. That integrates directly with SR referrals, pushing that information from Medtech AI across into the referral program. For public hospital referrals, you can use the templates to generate your documents, which will write back to the outbox, and then you can use that to send to public hospital referrals if you want. If you are using solutions such as the HealthLink online referral forms, because the consultation notes and that other data is being pushed from Evolution back, from Medtech AI back into Evolution, launching of those public referral forms through HealthLink will pre-populate the data that has been rewritten back into the PMS system.
Yep. So once you've done your consultation, you reviewed it, you've put it into Medtech Evolution, you can then go and create those referrals and or insert the information that you've had in that consultation quite easily.
This one's one for you, Cecilia. If a user was to correct a word, does it learn from that for the future? The scenario for this, it could be useful for Maori names or Maori terms that may be written into the documentation.
Yes and no. It is a large language model, and most importantly, we don't train off the large language model. However, we do have what we call some normalization going on of language, which isn't the AI learning. It's our sort of AI responsible AI guardrail going over the top to check the layer. So it's a yes and a no answer, in as much as the data is not being trained at all on anything that you say, but we are looking for mispronunciations, certain words that what we call is normalized to make sure that they're actually the right words. So it's a yes and no answer.
Okay, next, this looks to be something that one can access outside of Medtech and not a functionality restricted to being within the system. How does it connect with Medtech?
That might be one for you to answer, Alex.
Yeah. so of course, I'm going to just preface before I continue that the system was not named after me, but it does connect through Medtech Alex. So Alex is Application Layer Exchange, which is where the name is actually from. And that is our API layer that sits over your Medtech. So that is our seamless interoperability platform through which third parties can, with consent, connect to Medtech. And next, will it create medical certificates?
So if you've got an outbox document, an off-work certificate, we can certainly create those using the consultation details.
On the back of that one, quite a good one, can you make your own templates for notes? And can those notes go straight into an advanced form?
I'll start the first part of the question and then Liz, you answer the second. Yeah, you absolutely. The whole idea is that it is customizable to your requirements. So as you know, and I do appreciate there are so many features in this product that I flew through it today. But yeah, you can absolutely customize it to your needs. And you can have a number of different templates or different prompts. And one of the examples that comes up is, you know, depending on the type of the consult, I might want a little bit more on the social context. And so you might have two different forms, like a normal form, but one that's maybe more mental health focused that picks up those social elements that you want included in the notes in that format. And you can choose which one. And if you want to rerun the notes post it being finished because it was that kind of consult, you're talking about a couple of seconds. So you can definitely customize to your requirements. And then Liz, advanced forms, I'll go to you.
So it would really depend on what your advanced form is doing, how smart it is and what the settings are in it. But once you've got that data in Evolution, then you could certainly launch your advanced form to do what it is that you've got it set up for.
All right, next few questions. And Cecilia, this one's probably come up because you typed your email address into the screen. But the question is, do you have to type the email address or is it pre-populated?
No, it is pre-populated if the email address is in for the patient, and we're just using a lot of sample data here, so my apologies. And also, and also, sometimes people do put actual email addresses into the sample data, and we don't want any random person like Belinda Price at Gmail, the actual Belinda Price out there getting some actual thinking they've been to the doctors. So I do always make sure I use my own email address when doing any of this, just obviously for safety reasons.
All right. Does this work off-site, or do you have to be connected to the clinic's network?
So no, you can definitely be off-site. As long as your mobile has got connectivity and you've got your app running, then that will connect up, no problems. So it's highly designed for being out of the office and getting all that information at your fingertips.
All right, and one for you, Cecilia. If a patient's name or other identifiable information is mentioned during the consult, what would, hang on, I'm just going to read this. Would it be processed by the AI model?
We do have some pre-stripping that we attempt to do in there. And when I say attempt to do, we look for PII information to make sure it's stripped out of the system before it's in there. It's not going to be perfect. So, I'm sure you've all been given advice that try not to say the NHI numbers or people's date of birth when doing the ambient speech, but there is a layer in there that does strip PII information.
Okay, a very good one that's come through a few times is, are the recordings stored and how long for?
No and no. So
it's a real simple answer.
Yeah.
No.
So I'll just step through that because it's a really important point. The data is streamed. Okay, so there, that in itself does create a risk if there's a connectivity loss halfway through the consult. Unfortunately, it is lost. But therefore, we're not holding any audio at any point. So at no point can we retrieve the audio. That it is impossible. The transcript we with Medtech we aren't going to hold the transcript at all. But you can, if you leave the page without saving the notes to Medtech, it will give you two options. You can leave without saving. Maybe you were just in there checking, so you need that option. But you can insert with whatever has been generated at that point. If that happens, you will then get that pending note review, and then you can change the notes in Medtech. So it's that way of making sure that we're being safe and secure, but still giving you that option to go back and update and letting you know you need to go back and update.
And those draft consultations are shown in the daily record as showing that they're a draft copy, and then can be edited within Evolution.
Yeah, exactly.
So that's the only place that they'll be. Great. Okay.
All right, this next one I think is for you, Liz. How do I log into Medtech AI, and does it connect with my Evolution login?
Oh, that's another good question. So access to Medtech AI is currently separate from the PMS login. So users will log in using their own unique email address and password, which is what you would have been onboarded with. And that helps ensure that you've got the appropriate user level access and security. At this stage, it doesn't support a single sign-on with the PMS. However, we do provide the additional security measure of multi-factor authentication, which can add that extra layer of protection for user accounts.
Okay, and this next one looks like it might also be for you, Liz. Can you provide more detail as to what's coming next in the roadmap, and is what users start feeding back going to inform that?
Okay, that's another great question. So at the moment, we've shared the high-level areas that we're going to be exploring. but we're not going to get into detailed roadmap or timelines in today's session. If you're interested in learning about more where Medtech AI is heading, I'd really encourage you to join one of our smaller demo sessions or the upcoming education labs. Those sessions will give us a bit more of a chance to go into with more depth and have a more interactive conversation about the direction of the product. And yes, definitely, we're all ears. We'd love to hear your feedback. So you're welcome to put that in the Q&A area as well. We take on board any areas of interest that you have.
Okay. All right. I think we've got time for another couple.
3 minutes left.
Do we have any?
3
do we have
minutes?
this? Yeah,
minutes.
I've got
Yeah.
one more, and I think it's a quick and easy one.
Okay.
Do you have any patient informational sheets about the AI to hand out?
Are we talking about in regards to consent or?
I think information about the AI that is in use and practice.
Oh, we can certainly come up with some handouts available. Yeah.
And I think there's probably one last question that we can cover off before we finish up the presentation for today. And this one will be one for you, Alex. Has this replaced other AI options available through Alex apps?
Short answer is no, it has not. We believe in options here at Medtech as long as they integrate securely and through the appropriate channels with your evolution. So if you would like to use another one of our partnering options, you are absolutely welcome to.
And sorry, one more, just because it's very important. There's a lot of important questions here today. Will it work with Evolution if it is an on-premise deployment and not in the cloud? And that's a 100% yes. It does not matter if you are on-premise or hosted in the Medtech cloud or another hosting provider's cloud. As long as you're using Medtech Evolution, you can use Medtech AI.
That's brilliant. Great. And that's, I think, a great place to stop. So I want to just thank you so much, Cecilia, for taking the time to share with us today, and we really appreciate it. You've shown how Medtech AI brings together context, intelligence, and workflow integration, helping clinicians spend less time documenting and more time delivering care. So I'd like to thank you all for your time, and we really appreciate your interest, your questions, and your feedback. So please take care. Enjoy the rest of your week. Ka kite anō.